Dr. RJ Bruno. Wanted to talk a little bit about one of the current trends in medicine that is going to change, I think, the way medicine is done. And that's digital health or telehealth. A lot of the things that we're doing these days have to do with communication with physicians outside of the office. When the COVID pandemic came, there was a move to try to keep patients out of the office so that they didn't infect other patients. And so a lot of the visits at that time were done by telephone, by video chat, and even after the pandemic was over, a certain number of patients preferred to see their doctor by way of their computer screen rather than coming into the office. This adds convenience to medicine, but of course it takes away from the personal touch. There was a patient years ago who came into my office. He said to me that he had a cold and he wanted some medication for his cold. At that time, I put a stethoscope on his chest and I said to him, "Oh no, you don't have a cold. You have a pneumonia going on." So at that point, things changed. I needed to get a chest x-ray. I needed to put him on some antibiotics. And then I needed to see him again so that I could make sure that it cleared up. Potentially this man might have wound up in the emergency room with his pneumonia if it wasn't diagnosed. Because we knew that it was a pneumonia, we just wanted to get a chest x-ray to see what was going on, and then, some follow-up was necessary. So for a cold that might have lasted for 7 days, this was pneumonia that lasted for probably about a month. And if I had done that over the video chat, I would have never known that person had a pneumonia. So that's the thing about telehealth that I am concerned about. The fact that there's no way to examine a person by way of their phone or by way of their computer screen. Again, when I was doing those treatments, the patient would say, "I have a rash." And I would have to ask him to point to it because the video reception was not clear enough to be able to document a rash. The difference between a slightly red color of the skin and the normal color of the skin really wasn't able to be appreciated on a computer screen. In some cases, people use their phones to do the telehealth. And again, the resolution on a phone just isn't good enough to be able to figure those things out. The other thing was that if somebody had some problem, I had to have them describe it to me. Because again, I couldn't put a stethoscope on their chest. I couldn't tell how their breathing was. I couldn't tell if their heart was racing. If they had an arrhythmia of their heart, I wouldn't be able to know. If there was a murmur, I wouldn't know. If it was a pneumonia, I wouldn't know. So these are things that are difficult when you're talking about looking at things over the computer screen. Part of my job as a doctor is diagnosis, and it's difficult to diagnose when your hands are tied. I used to talk about telehealth as no better than veterinary medicine, because even though the person can talk to you, you can't see them, you can't examine, so your hands were tied. Just like if you have a dog in your veterinary practice, the dog can't talk to you, can't tell you what's going on, so you have to rely on other things to tell you what's going on with the person. So This is something that I wanted to kind of mention as a change in medicine that I think may take away from the personal approach. And I think people have to understand when they do telehealth that in some cases they're not going to get the best doctor anymore. They're just going to get a doctor. Okay, so I just consider these issues when you consider doing a telehealth visit.